the government had been taking many initiatives to combat. Why tuberculosis persists in India? Why tuberculosis persists in India? First point. Second, suggest some measures to tackle TB. That is second aspect of the question. And the directive word is about discuss. In discuss, you will have all the aspects of the question. You can take whatever it is. Discuss will give you certain liberty. It will give you a liberty to take whatever kind of option or the statement or the kind of pros or cons or advantage or analysis or criticism. What you can take whatever aspect you want with respect to the discuss directive word. It is giving you the direction that you can give measures in as many formats as possible, whether it is a case study or newly invented drug, whatever it may be, and also it is giving you the government it is giving you that how tuberculosis has been prevalent in India and what is the reason behind it. This is why means you need to provide reasons. When, okay. So next, coming to this part about TB, just we will have basics first before addressing this question. Tuberculosis is an infection caused by mycobacterial tuberculosis, mycobacterium. So it is caused by a bacteria that is named as myco. First point. Second, it can practically affect the organ of the body. And third, the most common ones are infected. The most common infected things in this tuberculosis disease is first lungs, and second the lining around the lungs, that is pleura, lining around the lungs, and third lymph nodes, and fourth intestines and spine and brain. So these lymph nodes are part of your innate immune system. They are usually in the shape of beans. Bean-shaped lymph node in a nodules. This is a kind of nodule. It will have a shape of bean, and it is part of your innate immune system. How will it protect you? Because it will filter the impure particles or substances in your body when they pass through these lymph nodes. Okay? Lymph nodes, they will usually placed in the neck part, and they are in the shape of beans. When certain impure elements and substances passing through these lymph nodes, they will be filterized and they will be purified. Okay? So innate immune system is simply protecting elements from foreign bodies. This is Richard. And symptoms. And it is and also one more thing, how will it spread? The cause of the mode and the agent, that is air. Air is the agent here. It is an airborne infection, and that spreads through close contact with infected, especially in the densely populated spaces with poor ventilation. Okay? So it is an airborne infection in a densely populated space. If a person is infected with tuberculosis, you will get that infection because of his close contact and also in a closed room. And symptoms are causes of these symptoms, and the usual common symptoms of this is active lung TB or cough with sputum and blood sometimes. Next, treatment. TB is a treatable and also curable, but it has a 3-stage step to cure you. Firstly, if you are not attacked by multi-drug resistant, that is only it is in the initial stage, anti-TB medicines can be used. Anti-TB medicines can be used, and these anti-TB medicines are not sufficient for nowadays because of this multi-drug resistant TB, MDR TB, that is called MDR TB, because there is huge resistance that is witnessed in this bacterium because of the medicine which has been used for last 1 decade. The medicines for the TB at the initial stage were now not effective to cure this TB disease because of the bacteria which has become very resistant nowadays. These are the two most powerful and first line anti-drug TB. Okay. Next, MDR TB is also treatable, curable. Second line, but if it is not treatable and curable, okay, if a first line TB drugs are fine, isoniazid and rifampicin, caused by bacteria that don't respond to isoniazid and rifampicin. If the second most powerful line of drug is that is bedaquiline. Bedaquiline. If the bedaquiline also doesn't work, then immediately you will get affected by, what does it mean? The symptom appears to be XDR TB, extensively drug resistant TB. It is very very serious, And multi-drug resistant TB is caused by bacteria that is which is not at all responded to your 2 stages of MDR, that is even anti-TB medicine, or also the medicine which is bedaquiline, MDR. And third stage is XDR TB. XDR TB is very severe, it is very dangerous, and no drug will respond to such kind of XDR TB. Therefore, it requires a lot of care and also the curative measure from the side of the healthcare personnel. Next, risk factors for the TB, that is among the risk factors for TB, undernutrition is the first factor, that is the factor which is causing the TB is undernutrition. And around 40% of the new TB cases are witnessed due to this undernutrition. And second, while other risk factors like diabetes, HIV infection, smoking, alcohol also are the causes of the TB, one of those risk factors of the TB. And types of TB. Types of TB is, there are 2 types of TB, that is clinical manifestation of tuberculosis, which are pulmonary in nature, and extrapulmonary in nature. Pulmonary in nature means which is affecting the lungs and lung lines, pulmonary in nature. If pulmonary is, if there is no TB which is associated with the lungs, but there is a TB pulmonary in nature, that is causing to lymph nodes. When you are affected by TB to your lymph nodes, this is called extrapulmonary TB. Okay, if it is only associated with the lungs and their associated organs, that is called pulmonary TB. If it is not associated with TB, that is what I call lungs, but it is causing the kind of lungs, pleural, lymph nodes, it is causing TB to pleural, lymph nodes, abdomen, and genito urinary tracts, and skins, joints, bones, and all these elements will get TB. Therefore, it is very clear that if I give you a question that TB is usually witnessed in the lungs, this is the first statement. And second, there is I think there are several factors that are causing the TB. One is airborne infection, and the second one is infection caused due to water, contaminated water consumption. Okay, this is second statement. So, what is the actual right statement here? So, the agent which is causing the TB is here airborne, right? And first one. And people who don't have sufficient innate immune system, when they reduce their innate immune system, therefore they will get affected by this TB. So people who are addicted to this alcohol consumption and some kind of what is called alcohol, cigarette consumption, and if they don't have hygienic lifestyle, they will get affected by this. And if they are staying continuously in the closed room, okay, with a lot of infected bacteria there, therefore they will get affected by this TB. Next, types of TB, that is fine. And next, for example, biliary TB is classified by pulmonary TB because there are lesions in the lungs. Lesions means a kind of what do you call it? Wounds. Okay, wound is which is caused by this PTB, that is pulmonary tuberculosis. Okay, on the other hand, tuberculosis intrathoracic lymphadenitis, that is mediastinal, that is related to intestinal, and also tuberculosis pleural effusion without radiographic abnormalities in the lungs constitutes case of EPTB, that is extrapulmonary tuberculosis. Okay, so when it is affecting your lymph nodes, it is said to be tuberculosis intrathoracic lymphadenitis. Okay, you don't need to have this kind of medical terminology, because the only one thing that you need to know is TB may be causing two different organs of your body, and the first organ, the primary organ that is mostly affected due to TB is lungs, and the second one is extrapulmonary TB, that is causing to even your bones, your meningitis, your pleura, your lymph nodes, and everything, and also other different parts of the innate immune system of our body, that is intestines also. Okay, so let's answer this question. The answer was given at the last page. How will you answer? Let us see. Model answer for today's expected mains question, because This is only a conceptual understanding regarding TB with respect to the prelims that I have been discussing till now. Now we are going to discuss mains. The mains question will not contain what is TB and what are the causes and what are the infectious elements and describe something like that. It will not ask questions like that, and till now we haven't witnessed such a kind of question. The questions will be like discuss why tuberculosis persists in India, discuss why tuberculosis persists in India. Therefore, the question pattern is completely changed. Till now you have understood only the TB and causes and agents and something, the types of TB and the curative measures, right? These are basics with respect to your prelims. But the question when it comes to mains, it will ask you a problem. You need to find the solution for the problem. The problem is here, tuberculosis heavily persisting in India. That is the biggest problem that you need to resolve. First point. Though the government had been taking many initiatives to combat tuberculosis. Government has been taking initiatives. Therefore, it is not a criticism associated with the government. Government has been striving its best. But you need more innovative measures to cut the TB issue. Therefore, suggest some measures to tackle the TB. 7. So, the question has two parts, reasons for persistence of TB and measures to tackle TB. Okay, question has two parts, that is reasons for persistence of TB and measures to tackle TB. This is, and the discuss is an all-encompassing directive, therefore you can take 360 degrees of analysis of this TB. So, I tell you, what are you doing there? You are not listening, right? Okay, you are talking something there. Okay, chit chat just no. Okay, next introduction part. You need to give a little bit of introduction about the tuberculosis. Okay, this is what are the causes and practically how will it affect the organ of the body, various organs of the body. Therefore, you will get some idea about its the intensification of the problem, because TB is because the question was about TB, not about malaria, typhoid, and dengue also. Why? Because TB is a problem with lot of intensity. Because in the medicine, in the medical field, because you need to address the health policy in various aspects, right? First, disease prevention, disease curation, also the list of diseases which are most effective in nature, how to curb them, and vaccination, disease prevention. The part of disease prevention, you need vaccination drives. And also in vaccination, you will have many prioritized areas which has to be given first priority. So this is the policy making, right? Therefore, you haven't got question related to your sinusitis or migraine or some kind of general diseases like fever, viral fevers, dengue, malaria, typhoid. So even polio also, okay, which is eradicated, and previously 2 decades ago it was one of the prevalent issues. So the question is about the TB because it has a lot of importance in our medical health policy issues. So the common, therefore you need to provide the intensity of problem with respect to this TB, associated TB. How will it affect and what is the reason behind it, and the types of TB and most common ones, and this is our introduction part. Next, reasons such persistence in the TB of TB. Reasons for persistence of TB, that is wrong diagnosis. Wrong diagnosis. Why? What is the reason behind it? Next, you need to biomarkers and other diagnostics that identify individuals at highest risk of progression to disease are inadequate. Therefore, doctors are also in less number to identify, and they are mostly untrained to deal with TB issue. That is the problem. Therefore, this is causing misdiagnosing the disease. If you go to a doctor, if you are continuously coughing with the blood, he may say it is due to some kind of stress. Okay, please change your lifestyle habits. Okay. Also, if you go to one of the professional doctors who hasn't been graduated from any institute, but he become a doctor after practicing under a doctor like R&D. Okay, and he will suggest you, okay, just sleep early in the night and also wake up as early as in the morning. Follow our traditions, customs. Therefore, you will get reduced to and you will not get exposed to this. This is also one of the greatest diagnosis that they have witnessed. They usually give you suggestions based on that diagnosis. And treatment. Treatment is inequitable access to quality diagnosis, and treatment remains a major issue in combating tuberculosis. Okay. So quality, affordable healthcare and also education. This is the most prioritized areas in your policy making. Okay? Inequitable access to quality diagnosis. Inequitable means more number of doctors are located in urban areas. Even 98% of the hospitals are also located in urban areas, and the professionals are in urban areas. Therefore, inequitable access to quality. Inequitable. Therefore, there is no such equitable. The proportionate to the population, the proportionate to the even population is mostly located in urban areas. That is around 35 to 37% now in urban areas. But 98% of multi-specialty hospitals are located in urban areas. This is one of the problems, right? Next, underreporting. One of the major factors for TB prevalence in India is underreporting of TB cases. Okay, people will say that what do you call? If you use cloves, also that is cardamom, and that is called what do you call cinnamon. Okay, and if you take steam regularly, you will get, and it will be cured very soon. So no need to go to doctor. These doctors are cheaters. Okay, they will earn so much money. So you don't. Therefore, you can treat yourself at your home. This is one of the factors that is causing underreporting. This is a casual thing that you might have witnessed in most of the communities. One of the major factors of TB prevalence in India is underreporting of TB cases. In the first stage itself, they can cure. If they don't address it at first stage, then immediately it will lead to multi-drug resistant TB. Okay. Next, this leaves the risk of spread of TB if they are reported. Next, poverty issue. Still a big problem. India associated with problems of undernourishment. 40% of the TB issues is associated with undernourishment, isn't it? Just now we have gone through this the statistics. A majority of TB patients in India are due to undernourishment, and poverty also impacts their ability to get treated. So these are the issues. And drug resistance to TB. Drug resistance. In the initial stage, even they are not reported, and also the bacteria which is being resistant to the usual TB medicine that has been given to these patients for last 1 decade is also one of the biggest issues, and this multi-drug resistant TB is emerging now. And the government, in prioritized areas of policy making, government has been focusing on these antibacterial issues. Okay, if the bacteria is becoming very resistant to even bollworm bacteria, that is Bacillus thuringiensis, American bollworm, right, which is now resistant to Bt cotton. That is also biggest challenge. Even using this Bt cotton, they are unable to protect their cotton production. They are unable to maximize this production, and pest resistance has been increasing in this Bt issue. And therefore, government has asked question on Bt in prelims twice and also mains once. Have you seen that Bt cotton issue? Yes, which was prevalent in 2011-13 times because of the resistance, pest resistance developed in this Bt bacteria, Bacillus thuringiensis. So this is one more. So prioritized areas, you can understand that bacteria resistance. I mean the drug resistant bacteria which is prevalent nowadays. Next, due to lack of, and also what is the reason behind it? Drug resistance bacteria which is going to be affecting our health sector now. Reason behind is there is no prescription. Okay, you can buy as many antibacteria medicines as possible. If you can address anywhere. I can go anywhere. Nobody asks you the prescription which is prescribed by the actual authentic doctors. Okay, you can directly go and prescribe your own medicine there. Okay, you are the doctor to yourself. Okay, you will take medicine according to your wish there. So no, don't give that cough medicine and give that some kind of, what is it? Yeah, cough is fine now. I can understand myself and I can address myself. You will giving treatment to yourself and you are prescribing medicines to yourself and you are using as many antibacterial medicine as yours. That is the problem that India has been witnessing. So proper prescription has to be given. Followed as per the guidelines given to these medical shops. Next, outdated drugs. Drugs used to treat TB, especially multi-drug resistant TB, are decades old. So it is only recently bedaquiline and delaminate which are resistant to this multi-drug resistant TB, which has been made available now. However, access to such drugs remain low now. Next, implementation of RNCTP, that is Revised National TB Control Program. Revised National TB Control Program. At state level is another major concern. And social stigma associated with TB patients. When people get TB, therefore they will get isolated and they will not be treated with concern and also empathy. This is the patient often hesitate to seek treatment, therefore, and because of the social stigma issue. So this is causing again multi-drug resistance TB and extended TB, extensive TB. Next, measures to tackle TB. How will you tackle this issue? First, awareness, education, empowerment, these are fine. And role of society, civil society and media, this is also fine. But you need to give specific solutions for these kind of problems. You need to find other solutions also, not only in this model answer. Efforts must be made to address the issue of undernourishment, diabetes, alcohol, tobacco use. And next, mass awareness campaigns against social taboos regarding TB should be done through media educating people about the disease precautions and also its cure. So, mass awareness, not media, precautions and its cure. This is a general statement, but not a specific solution here. Next, efforts must be made to address the issues of undernourishment. How will you give a specific solution for it? Suppose any scheme related to nourishment, okay, Matrutva Vandana Yojana, Janni Suraksha Yojana. Next, okay, this is a maternity, midday meal scheme, okay. So, Poshan Abhiyan, good. So, therefore, these are the schemes, you need to address them while answering, and also effectively they have to be implemented. Just substantiation. Next, government should build accountable. Any testimony that you can give regarding mass awareness campaigns against social taboos, mass awareness campaigns against social taboos, mass awareness campaigns against social taboos, that is social stigma. So, the kind of okay, Me Too awareness. This is okay. You are so much so concerned about okay women. Okay, it is not associated with women. So it is not Me Too related, right? You can see in your childhood. Have you seen any video related to this awareness campaign? That is Puli Raja ki AIDS ostunda. This is okay. People used to laugh so much at that time, but they could know that this is related to awareness campaign. It became very popular, and fear factor was imbibed in their mind that they should take caution about it. Isn't it? The stigma associated with the use of those contraceptive things is going away nowadays. I think the stigma is going away now. This is now in Indian society, the sexual education is very less in Indian society. In 2 decades ago at least. Now it is fine at least. 2 decades ago it was quite difficult to educate them how to use sanitary napkins like this. So people have removed such a social taboo by using certain creative and innovative mass awareness campaigns. So can you give that innovative mass awareness campaign now? With respect, this is different reverse stigmatization. Reverse stigmatization means people who are urinating at public places are provided and felicitated publicly. People clap them and stand around them, they will clap while they are passing urine. Okay. This is also an advertisement given in cinema halls. Okay, have you seen? When they are throwing dust from their balcony, and people, their surrounding people from balcony come out and they will clap at them. Okay, they will felicitate also. This is one more. Next, and one more awareness is like Munnabai Lagero. Some is what is it? Here, the person who has been roaming for his pension for last 6 months, and he was tortured by this corruption, that officer. Therefore, he used to remove his entire cloth there, his shirt, his pant, and even he removes his spectacles and shoes, and he tries to remove his banyan at the time. There immediately he will sign and he will give the talk. This is related to a case study and testimony, right? you need to concise it and precisely address it, but it should be very formal in nature. Okay, while writing answer, that will make your answer very unique. Okay, don't write one single example by everybody, right? The example should be original, that should be addressed by you only, and that example should be innovative, and that should never lead to any kind of stigmatization or any kind of a positive stigmatization that can give a solution to it. Okay. Next, government should build accountability among health professionals and ensure sufficient sustainable financing to provide access to prevention and treatment. Okay, all hospitals. This is also government should build accountability among health professionals. Ensure sufficient sustainable financing. What does it mean? Accountability. Suppose government has been giving lot of funds to address this kind of TB menace in our country, and health professionals might say that we have visited number of houses in this village, like auxiliary nursing midwives, also these primary healthcare professionals. Okay, they will visit various households in the village, and they will check whether there are any TB issues in village in any household. But the reports are not accurate. They don't visit it and they will give misinformation. So you need to impart accountability mechanism. Say scrutiny and monitoring mechanism has to be there, whether they are doing it or not. A random check and keep an eye about, on their work role and profession is also very important. Do you know that auxiliary nursing midwives and also these primary healthcare professionals? Yes, yeah, ASHA workers, right? So, they are ASHA workers are social health activists. Okay, yes, they mostly contribute to safe and secure maternity issues, right? Next, to provide access to prevention treatment. Next, all hospitals should create an aftercare system in which every TB case should be followed up regularly at periodic intervals. This is also a kind of grievance redressal and also monitoring and follow-up thing, which has to be imported systematically. Next, we need to sensitize healthcare providers to issue faced by those TB and ensure that they act in non-discriminatory manner. Okay, what does it mean non-discriminatory manner? Okay, suppose it is a house of Reddy Patel Patwari there in the village. Reddy sir has got TB, therefore they have to give whole priority for entire month at the first line only. The entire time will be dedicated to that household. Okay, the remaining people will not get addressed by this problem, that is menace. So, non-discriminatory nature, everybody should be treated equally there, and there should not be any social stereotypism associated with TB treatment, and not only TB and various other things. Right? It is important to address the social conditions and factors which contribute to and also increase vulnerability to tuberculosis. This is important. Social conditions and factors which contribute to increase vulnerability. Social conditions. What are social conditions here? Undernourishment, poverty, right? Lack of awareness, literacy. This is point. Yes, very good. Stigma, social stigma. It is important to invest more R&D. Okay, more R&D should be on drug regimens. So government has to support this R&D. Next, we must provide both treatment and legal literacy to provide. In each sector, you need R&D there, right? Because even content development also we need R&D nowadays. Have you seen, how many have you seen 2023 paper? Prelims paper. You please go through that paper. Very good, Saitaja. 42 questions it seems. There was no elimination option for the statement based questions. 42 questions. And each statement is giving you a new type of question there, because initially, if you are able to eliminate one statement, you will get answer, or if you are able to include one statement, you will get answer. Now, you need to know whether this option is true or false for each statement. If you don't know one statement, you will not get answer. Okay, if they have given 3 statements, you know only 2 statements are true, but third statement whether true or false, you don't know. Will you get answer? No. Without elimination? No. So, the cutoff may be reduced to, in 2016 it was 116, and later in 105 in 2017, and 2018 it was 98, 2019 it was 98 again, in 40% threshold of open category in 2019, the cutoff has to be increased at least, because the number of posts reduced in the open category, still the cutoff is only 98, okay, which I witnessed in 98 in 2018 also. 2018 98, 2019 98 again. And cutoff is 2020 to 2020, the cutoff is 91, okay, and 2021 the cutoff is 88, isn't it? 2022 cutoff is how much? 70, 75 above, 80, 86. So next 2023 will be 68. Open category cutoff. So mostly is 77 to 80 it seems. 80 it seems. Okay. So what is the reason behind it? Your complete knowledge about NCERTs is not sufficient now. Your complete knowledge is not sufficient on first point. On second, your continuous revision is also not sufficient. Okay, your regular practice of test series is also not sufficient. What is most important element and aspect here is extensive reading and extensive study has to go on. One side, extensive study has to go on. On the other side, on the other side, you need to build the application oriented interlinking. Suppose while addressing this what Chandrayaan and some kind of issues that I have discussed in the KPIB, right? In issues tourism policy, digital data protection. So here, have we discussed only the policy issue there? No. We have discussed about big data, blockchain technology, and also artificial intelligence, and how to address the biggest challenge that we are going to face in the coming years. So we have understood about the application of those challenges. Therefore, you need to have a policy. That is, government has brought this kind of new startup policy to address these new future problems. We have addressed each policy line in application oriented, and also we have interlinked with day-to-day life. Okay, this kind of application oriented interlinking has to be developed while attempting the questions. Now the questions are little simple in nature now. In future, you will see the second stage of questions will be, means the after first cycle you will be having the second cycle is mostly the questions you might have read but you don't know the answer. Okay, the questions will come from the areas which you haven't studied at all. So the major aspect, the major thing that you need to develop is your originality. Your originality, how much your mind is prepared for unprepared questions. So your ability to answer unprepared questions is your ability to clear the exam. That is the demand of the exam nowadays. So the unprepared, as many unprepared, unanswerable, as many statements which are not at all related to your references till now which you have studied are more important to solve in the test series. So the test series should never contain the questions that you have prepared already. Test series will definitely contain questions that they have asked. One question regarding chess championship that is held in Chennai, right? So there are two types of awarding systems there, and based on the names of those prominent personalities. If you go through this 2023 question paper, this is really ridiculous to answer that question. It is quite difficult. Okay, even a chess player who follows it seriously may not be knowing it properly, isn't it? So this is a question now. Also there are statement 1, statement 2 based questions which are factual at the same time interlinked with the interlinked with analysis. So you please go through the questions which are not at all relevant to you, which you haven't witnessed till now in your reference books, but still you are able to solve it 50%. Still, if you still able to solve 50% of the questions, you will be in the list. Okay, so exam is expecting you to prepare for unprepared questions, therefore it requires lot of mental stability and your originality. Originality lies in your understanding of the concept and application of the concept and your ability to interlink with the day-to-day life, general life, generic understanding. These are the requirements nowadays the exam is demanding. So please try to develop those things and try to write answer for this question also. And tomorrow we are going to discuss one more question, right?